Gold Learning. Welcome to our Gold Lactation Online Conference 2023. Our presentation today is titled, The Many Colors of Breast Milk. What does it all mean? As presented by Dr. Farouz Azway and Dr. Amal Tawil. We're so glad that you've joined us here today. Now here is just a brief announcement from Gold. Gold is very excited about our learning library with over 400 presentations that allow healthcare professionals to access and earn continuing education credits from past Gold conference sessions. And of course, they can learn 365 days of the year. We also offer new presentations that are unique to Gold Learning, such as our ethics package and, of course, our Gold Learning Symposium series. Be sure to check it all out at goldlearning.com. And now just to check in with our slides here, please view the disclosure slide pertaining to this presentation. It is here for you to view at your convenience. And now it gives me great pleasure to introduce our expert speakers here today. Dr. Amal Tawil is a graduate of Faculty of Medicine at Cairo University, class of 1986. She obtained her Master's of Pediatrics in 1992 from the Faculty of Medicine in Cairo University and Doctorate of Pediatrics from the Al-Azhar University in 2002. She became an IBCLC in 2003, and since 2004, she has been providing pre-exam course of Egyptian Lactation Consultant Association, of which she is a board member, treasurer, and education coordinator. This program has been helping hundreds of Egyptian and Arab healthcare providers to certify as IBCLCs. She is also a member of the advisory committee of IBFAM Arab World since 2012. She is a member of ILCA since 2008 and a member of the Academy of Breastfeeding Medicine since 2009. She became a fellow and a board member of ABM in 2021. Dr. Farouz Azway is a pediatrician neonatology consultant and an international board certified lactation consultant, a neonatology Egyptian fellowship trainer, and a baby friendly health initiative coordinator and associate alumni member of Harvard Medical School. Dr. Farouz works as a neonatologist in El Minora NICU, and in 2016, she joined the LCCC course as a trainer, lecturer, and course developer to train and qualify the medical team of IBCLC certification under the auspice of the ELCA, along with her work as a lactation consultant and baby-friendly coordinator and trainer for the 20-hour course since 2019 in the maternity hospital. She became a neonatology Egyptian fellowship trainer in 2020, and she received Egypt Training of Trainers Harvard Medical School in 2020 and Research Training for Egyptian Researchers Harvard Medical School in 2021. She is a member of the Egyptian Society of Pediatrics and the Egyptian Lactation Consultant Association and the Academy of Breastfeeding Medicine, and of course, International Lactation Consultant Association. Please welcome everyone, Dr. Farouz and Azway and Dr. Amal Tawil.
Hello, everyone. Nice to be with you again.
Hello, Gold Lactation participants. Welcome from Egypt. I'm happy to be with you today on the second day of the live streaming of the Gold Lactation Conference. And I am honored and to be with my teacher and my role model, Dr. Amal Tawil, to talk about the many colors of breast milk and what does it all mean, and to present some of the cases that we dealt with.
Nice to be with you again and to go through some of the cases that were alarming to mothers and families and maybe even healthcare workers regarding different or unusual colors of breast milk. In this presentation, we aim to describe characteristics of milk color in different stages of lactation, the usual colors that we encounter during the different stages or even during a single feed. And also from that, we need to discuss the causes of abnormal or unusual breast milk colors. And we will compare the management of different cases with unusual milk colors and the diagnostic approach for cases with these different colors. We have some photos that can be of commercial products, but we tried to obscure them for avoidance of conflict of interest as much as we could. But this is only for the illustration, not for advertising. And these are things that we have used with our cases. We have no financial interest with the manufacturers of these products whatsoever. And we have no actual or potential disclaimers to make in relation to this program. As we know, to know the usual composition of breast milk contains the nutrient content, the carbohydrate content, the protein, the fat, and so many bioactive non-nutritive components, mainly the long chain polyunsaturated fatty acids, the oligosaccharides, the immune cells, which have a wide array of like macrophages, like lymphocytes, neutrophils, and stem cells also. There is also the docosahexaenoic acid. There are growth factors, many growth factors, many hormones, and essential fatty acids, and the antibacterial and antiviral enzymes. Usually, during the course of lactation, we get different stages of breast milk composition. As we see here, different colors during the different stages of lactation. We start with the colostrum, which is typically yellow, clear, jelly-like, very viscid in consistency. The yellow color is due to the richness in beta-carotene, which is responsible for the colostrum, this yellow color. It's in the beginning, the very beginning, it's clear, but it becomes turbid as it starts attaining more carbohydrates and more fat. And of course, it's very small in amount, corresponding to the size of the baby's stomach. Then as we advance in lactation, like starting the third day or even earlier in a woman who has breastfed before, it becomes creamier, and it has a high level of proteins, vitamins, fat, and lactose, higher than the colostrum. The color changes slowly from yellow to white. Then we come to the mature milk, which is the final stage of breast milk transition. This is the mature stage, and it's typically reached by 4 weeks postpartum. As we see here, it can come in a very white color, but sometimes even it has a blue hue to it. And we will go through other different hues that are can be encountered in the course of normal lactation. During a single breastfeed, there is also a possibility that we see the difference between a hind milk and the fore milk. The hind milk, as we see the bigger bottle here, is rich in lactose and water, and it has a lower concentration of fats. That's why it looks a little bit watery. But as we advance during the same feed, we get more fat and the milk turns into a whiter and creamier consistency. But there can be also some unusual colors that can be alarming either to the family or to the healthcare provider that is providing care either to the child or to the mother or both. And we come to the poll.
We now have a poll for you. Has anyone among you met a case of a mother whose milk is of unusual color, and what was it? Red milk, green, pink, brown, red, blood, blue, clear, red and green, a clear one. Okay. Rusty color, pink, blue, red and green. Great. A technicolor.
Yeah.
Pink, blue.
I want to ask, pink, blue, in the same specimen or pink and blue?
We have an answer, a true blue. Dye from pill was best explanation.
Mm.
Red milk.
Mm.
Okay. So the red have the upper
The
hand.
majority, yes.
Yes.
Okay, then we can go back
Again,
to our slides. So since most of you have seen red milk, then we start with the red milk. And we are talking about different degrees or different shades of red, starting from frank blood to or frank red to a pink hue. This can be due to a cracked or damaged nipple, or bacterial infection with Serratia macrosenses, maybe intraductal papilloma, maybe severe engorgement or mastitis, maybe eating food with red dye, or even breast cancer. We start with the most common. This is a cracked nipple, trauma, or trauma from improper latch, or from a tongue-tied baby, maybe an infection, maybe eczema, as is shown in this picture. This is a patient with eczema. From dryness of the skin, we get cracks that don't heal. Or maybe pumping with a pump that has an improper flange size. Maybe it's an intraductal papilloma, a bleeding from an intraductal papilloma. An intraductal papilloma are benign and non-cancerous, but can transform to a cancerous lesion. It is a wart-like tumor that grows within the milk ducts of the breast. The finger-like projections may erode, then bleed. That's why they produce the bloody or blood-stained milk. The abnormal proliferation of ductal epithelial cells causes this growth. The ductal papilloma is usually unilateral. What do we do with it? It is diagnosed radiographically with mammography, but as we all know that during lactation and during pregnancy, mammography is not a very good suggestion. So breast ultrasound is the modality of choice, and maybe magnetic resonance imaging can be also used. Also, mothers are very much concerned about whether to feed the baby or not. Of course, feeding the baby can be allowed, but mothers maybe they refrain from that, or maybe the baby does not like the taste of the rusty taste of or the metallic taste of the blood in the milk. Also, this may be due the color, especially a pink color, not a frank red color, can be due to an infection with Serratia marcicensis, which is a species of rod-shaped, as we see here.
Okay. Also, we can see the pink color with a Serratia, which is a species of rod-shaped gram-negative bacteria. Serratia is an important organism. It causes mastitis in lactating women, and it may affect the baby, causing sepsis, and may reach up to meningitis, which is an alarming problem in babies. So if we think in mastitis, or if we suspect Serratia, we need to do a milk culture for the mother to reach for Serratia and to start antibiotic according to the culture and sensitivity of the milk culture. Serratia is an opportunistic pathogen and a common cause infectious outbreak in hospitals. So it can go in outbreak fashion. Okay, and some clinical strains may produce characteristic red pigment and decolonization, which can turn breast milk into pink color. So if we have a pink color or strawberry color, think in Serratia and put it in your differential diagnosis. Also, in cases of red milk, we think in engorgement and mastitis. The inflammation of the breast may accompanied by infection, and during engorgement, the vessels become engorged, and this may cause it to bleed into the ducts of the milk. So the mother may produce red milk during the attacks of engorgement. Also, lactational mastitis occur due to a combination of oversupply or inadequate drainage of the breast milk with the introduction of bacteria. And the common scenario for that is the poor milk drainage because of infrequent feeding, or if the baby have mechanical problem like tongue tie, or if the mother have over supply or abundant milk that didn't remove or that they didn't cope with. And in cases of abrupt weaning, or in cases of illness in the mother or child that cause incomplete and infrequent milk removal. And also in cases of clogged duct. Some cases of clogged duct, if untreated, may go through mastitis. According to the APM, the recent clinical protocol, 36 protocol, mastitis can result from combination of oversupply and dysbiosis. Dr. Amal, are you with us?
Yes.
Okay. Please give a.
Okay, we have another poll.
What do you
So
think, or what is your suggestion to a mother who has a bloody milk about feeding her baby this